Out of there, so the Prime Minister's been talking to Chief Ministers, trying to get a sense from them as to what should happen after May the 17th once the lockdown presumably is relaxed a little bit or changed in some form or the other. Now remember, these entire conversations are coming in the backdrop of 4 or 5 days of rising cases, including Sunday, which saw the largest ever single day jump in cases in India. More than half of them, or nearly half of them, coming from Maharashtra alone. Some of them, of course, because of a backlog. But the consensus view is increasingly that you can't keep the country locked down forever. So we'll have to figure out what relaxations can come and where. An important signal in that direction is the fact that trains are going to be restarting tomorrow. And today, the website for blocking train travels or figuring out how you can travel from one place to the other actually collapsed under the weight or the number of people who were actually trying to log on. The Home Ministry has also circulated a set of rules as to how people can travel on the trains from one place to the other. But one thing has been left to the states, and I just want to talk about it for a minute because it's really important. It has been stated that medical procedures will be followed at the destinations. Now, it's important to get those medical procedures absolutely correct because we know till now coronavirus has been concentrated in 3 or 4 states in India. As people start to travel, you don't want states that have been relatively unaffected to start suddenly getting coronavirus cases. So tracing, contact tracing at the destinations is going to be required. Testing perhaps may be required, and who knows, possibly quarantine as well. But let's just bring you up to date with all the big stories of the day, including from that meeting with the Prime Minister and the Chief Ministers.
As the crisis of migrant labourers continues to unfold, Prime Minister Narendra Modi told Chief Ministers of various states that it was human nature to want to go home. PM Modi held a video conference with Chief Ministers on Monday, about a week before the third phase of the lockdown ends. PM Modi said at the meeting that the government will have to think about moving forward and talked about a holistic approach. He said that governments will have to ensure that the deadly virus doesn't spread to villages. This is the Prime Minister's 5th video conference with Chief Ministers.
West Bengal Chief Minister Mamata Banerjee said on Monday that the centre should not play politics at a time when the coronavirus pandemic has gripped the country. She said at the video conference with Prime Minister Narendra Modi that Bengal is surrounded by international borders and other bigger states and has challenges to deal with. The TMC chief said all the states should be given equal importance and should work together as Team India. Amid the war of words between the centre and the Bengal government, she remarked that the federal structure should be respected. Coronavirus-infected patients can end home isolation after 17 days of onset of symptoms or date of sampling, and if they have no fever for 10 days without getting tested again for Covid-19, according to revised guidelines for home isolation of very mild or pre-symptomatic cases. The revised guidelines released by the Health Ministry reiterated that patients who are pre-symptomatic or have very mild symptoms can opt for home isolation if they have the requisite self-isolation facility at their residence so as to avoid contact with other family members. The patient should be clinically assigned as a very mild case or pre-symptomatic case by the treating medical officer.
India recorded the biggest single-day jump in the number of coronavirus patients with 4,213 new cases in the last 24 hours and 97 deaths. The spike takes the total number of cases to 67,152 so far, according to the Health Ministry data on Monday morning. The total number of deaths in India linked to one of the most contagious illnesses the world has seen in recent decades has soared to 2,206. Close to 21,000 people have recovered from the infection so far. After 50 days of suspension of its passenger operations due to Covid-19 lockdown, the Indian Railways will gradually restart passenger train operations from May 12th, initially with 15 pairs of trains, which means 30 return journeys. Tickets will only be available online and booking will start today. These trains will run as special trains from New Delhi, connecting Dibrugarh, Agartala, Howrah, Patna, Bilaspur, Ranchi, Bhubaneswar, Secunderabad, Bengaluru, Chennai, Tiruvananthapuram, Madgaon, Mumbai Central, Ahmedabad and Jammu Tawi. Only passengers with valid confirmed tickets will be allowed to enter the railway stations. It will be mandatory for the passengers to wear face cover and undergo screening at departure, and only asymptomatic passengers will be allowed to board the train.
Congress leader Rahul Gandhi on Monday spoke out against the reported dilution of labour laws by some states and said that the battle against coronavirus can't be an excuse to suppress the voices of millions of workers. Championing the cause of factory workers, Rahul said, "Coronavirus can't be an excuse to trample human rights, allow unsafe workplaces, exploit workers and suppress their voices." Earlier, 8 political parties wrote to President Kovind protesting the changes to labour laws, which include extending the daily working hours from 8 to 12 in 6 states on the grounds of fighting the Covid-19 pandemic. Maharashtra Disease Surveillance Officer Dr. Pradeep Aute has said that there is some evidence of community transmission of Covid-19 in parts of Mumbai and Maharashtra, the Hindustan Times has reported. However, the overall picture in the state is that of cluster cases, the official added. On the rising number of Covid-19 cases in Mumbai, Aute said its case is very different as compared to other regions in the country. It is densely populated and has a distinct socio-economic significance.
India has decided to amp up its medical assistance effort to help authorities abroad combat COVID-19 and has targets to cover over 90 countries over the next few weeks, Hindustan Times reported. New Delhi's diplomatic outreach is expected to cost 110 to 120 crore rupees, according to the report. The Foreign Ministry so far pledged to supply drugs, testing kits and other medical assistance worth 60 crore rupees to 67 countries. Out of these 67 nations, the government has already delivered consignments in 29 countries in South Asia, the Gulf, Central Asia, and even remotely located countries like Dominican Republic and Ecuador.
The World Health Organization's Special Envoy on Covid-19, David Nabarro, has said that he did not see a vaccine coming to the help of people before the next 2 years. In an interview with the Indian Express, Nabarro said that it was better that countries and people learn to live with the virus at least for that long. He praised India for managing to slow down the spread of the virus and keep it contained to some urban pockets. But Nabarro warned that as the lockdown is lifted, the outbreak will take place and countries need to be prepared to deal with it. Wuhan on Monday reported its first cluster of infections since a lockdown on the central Chinese city was lifted a month ago. 5 new confirmed cases were reported, all of whom live in the same residential compound. All of the confirmed cases were previously classified as asymptomatic, which is people who test positive for the virus and are capable of infecting others but do not show clinical signs such as fever. The resurgence has stoked concerns of a wider resurgence of the disease in the city, which is believed to be the epicenter of the new coronavirus outbreak in China.